why every heart patient who has been shown multiple blockages by interventional cardiologist in angiography in hospital should not go for invasive process without golden hour, without any emergency. Because you know, invasive process are doing harm to endothelium, that is heart of the heart of the vascular system, that is damaging the endothelium. So the procedure itself damage the endothelium, and the prothrombotic stents puts inside the vessels in a stable condition by showing multiple blockages 90%, 99%, 80%, 70%, 50%, and put stents inside vessels of diameter of 4 to 2 centimeter is going to reblock again, otherwise rethrombosis can occur if you stop medicine. So procedure damaged the basic infrastructure of the heart. Either you go for bypass surgery, you have been shown multiple blockage. They are not removing the blockage. They are just bypassing the blockage by taking one vessel from hand or chest, or one vein from leg, and reverse it and apply joint above blockage and below blockage. So blood flow will be diverted. So in surgery, bypass surgery also, blockage is not going to be removed. Blood flow is going to divert it. So the basic treatment of invasion procedure is to improvise blood flow by revascularization. But that is invasive, that damage the basic heart of the arteries, endothelium, that damage the endothelium. And once endothelium is damaged, again and again reblockage is going to occur. So EECP treatment has been approved by FDA all over the world. Why? Because it is synchronized with cardiac cycle, and it is non-invasive, no cut, no radiation, not a single drug applied in the body. So it has no side effects that is significant. EECP works as a second heart, like a IABP works in a bypass surgery when heart is weak. And if you go for bypass surgery, they cannot do bypass surgery without IABP. And on the contrary, despite using IABP, intra-aortic balloon pump, after bypass surgery, low pumping of the heart patients, pumping doesn't improve because of ischemic reperfusion injury. So there are a lot of studies that show that after bypass surgery, pumping doesn't improve. And in stable condition, after stenting, that is same, pumping doesn't improve. EECP is a procedure, works with cardiac cycle. 3 cups are applied on the leg, lower leg, middle leg, and thigh region, gluteal region, and chest electrodes are applied like ECG on the chest. The patient has to just come and lie down on the EECP table, and technician applied electrodes and pneumatic cuff. That is externally applied, that is no harm to the patients. And then ECG will reflect on the computer console of the EECP ticket machine, and plethysmograph is applied on the index finger, that is to measure SpO2 and to show the waveform on the EECP, because indirectly EECP and computer console of the EECP and the heart is reciprocated when you applied chest electrodes, pneumatic cuff and plethysmograph. Chest electrode is applied on the chest. Pneumatic cuffs are applied on the three parts of the leg, and plethysmograph is applied on the index finger. Then ECG will reflect on the computer console of the EECP, and when machine starts by technician under the guidance of doctor, when heart is in a relaxing position, there is a pressure from lower leg to middle leg to upper leg, and then to aortic region to the coronary vasculature. And during heart is relaxed, the semilunar valves are closed, so the pressure applied from the leg is going to directly to the coronary vasculature by the root of aorta and increase the diastolic augmentation and coronary perfusion and myocardial perfusion. And in a weak heart patients and in a massive heart attack patients, scar formation has occurred after the heart attack. EECP is such a wonderful that it increases vascular growth factor, platelet-rich growth factor, stem cells. So do angiogenesis. And angiogenesis done by pressurized system. When heart is in relax, pressure is applied. When heart is in contract, pressure is released. That is according to cardiac cycle. So when pressure is released, afterload of the heart will be decreased. So pumping of the heart will increase. And simultaneously, venous return also increase, cardiac index and cardiac output increase due to increased venous return. But in heart failure patients, there is a protocol to restrict venous return or to prevent venous congestion. So EECP pierces the scar tissue by developing new vessels, by making growth factors, stem cell, progenitor cells, nitrous oxide secretion, vasodilator secretions. So it tears the scarring tissue and increase the blood supply in the scarring muscle. That is the beauty of this mechanical procedure without any hurting the body. And in systole diastole, when heart is relaxed, pressure is applied, heart is in contractility, pressure is released. So heart's pumping become increased, and improvement of the blood flow in the whole heart muscle, including scar tissue, damaged tissue, and reduction of the afterload leads to increased pumping of the heart after heart attack, in heart failure, in weak heart. EECP also reduce the insulin resistance, so it improve glucose utilization. So diabetic patient has sometimes decreased the medicines or insulin. It EECP also increase renal blood flow, renal artery blood flow. So creatinine levels in renal artery patients come down. EECP increase blood flow to the all organ. It increase blood to the ischemic brain also. It increase blood flow in peripheral arterial region. It increase the vitality. So overall stamina increase, not only heart, but whole body stamina increased. So EECP is the only treatment in the heart treatments armamentarium, only treatment that works as cardiac cycles in reference to cardiac cycle. Otherwise, all the procedures are just to increase blood flow drastically. So lively myocardium also die. Sudden improvement of blood flow will damage the lively myocardium. That's why after heart bypass surgery, pumping is not increased. But in EECP, indirect pressure is applied. So there is no sudden surge of inflammatory markers, cytokinins, and lively cells are not going to die. But gradually developing new vessels and angiogenesis, there is a increased blood supply to the lively myocardium and damaged heart muscle. But EECP should be taken not by advertisement factor or social media likes or hype of infrastructure. EECP should be taken by trained doctor. EECP should not be taken like this doctor has a 50 center, 100 centers. So he cannot focus on the patient. He's going to expand. If suppose I expand 100 center, I'm not going to focus on the particular patients, how it is going to improve. So should be taken by trained doctor, experienced doctor, and your heart will be rejuvenated and heart pumping will improve. Stent patients can also take EECP treatment. Bypass patients after bypass can also, before bypass you can also take EECP treatment to develop collaterals and develop angiogenesis and collateralization of the heart. So it is a authentic treatment, and it should be taken by authentic doctor who can give you proper, because sometimes what happens if patient has hypertrophic cardiomyopathy or aortic regurgitation severe, you cannot give EECP. So some criteria has to be excluded. Suppose some patient has DVT, deep vein thrombosis in low leg, you have to rule out. Otherwise, EECP is a treatment of the heart of the century, new century. Thank you very much.